Hi, I'm Stacy, and today we're here to introduce to you SHINE, a global stroke collaboration led by stroke survivors. SHINE stands for Survivors Honoring Inclusion, Networking, and Empowerment. I'm joined by my co-founder, Melinda, our scientific director from Norway, our communications director, Stacie, in the US by video, and by our colleague, Erica from Bayer, who works in the innovation of stroke treatment in Germany. Here are our disclosures. 1 in 4 adults will experience a stroke in their lifetime, and 22% of those living with the effects of stroke will be under the age of 49. However, behind every statistic, there is a person. SHINE is about what happens when those people, stroke survivors, take the lead in shaping the systems that support them together with those who work within them. This film is a chance to share what SHINE is, how we began, and what we're building, and why stroke survivor co-design matters for the future of stroke care. It's the first global initiative led entirely by people with lived experience of stroke. And this is created to close a gap that has been left open for far too long. A gap between those who lived through stroke and those who shape what happens next.
Hi, I'm Melinda, a stroke scientist with clinical and lived experience of stroke. Research shows a consistent pattern in many settings globally. Improved acute stroke care, but inconsistent support when the survivors leave the hospital. But the great news is, across regions, survivor advocates are already breaking boundaries and redefining what life after stroke can mean. SHINE exists to celebrate and connect these voices, giving them a platform to share best practices, support science, and lead change together. Survivor-led and globally connected, we bring evidence and lived insight together, working with systems, science, and communities to create meaningful exchange and partnerships.
Hi, I'm Erica, and I work on partnerships and innovation in stroke care with Bayer. For us at Bayer, partnership means learning and leading together to shape how survivor-led innovation can create a more responsible and inclusive future for healthcare. We want to understand how survivor leadership can shape innovation responsibly and how industry can support that change with respect and transparency.
Hi, I'm Stacy. SHINE was born from a simple realization that survivors were being invited to share their stories, but rarely invited to co-design. We saw this gap again and again and decided to build the structure that was missing. Even the World Health Organization's Rehabilitation 2030 initiative recognizes that user involvement is essential, but it also acknowledges that it's often missing. SHINE exists to help make that shift possible, to move from participation to leadership.
When I first learned about SHINE, I saw something rare. A movement led by stroke survivors that's building its own evidence-based and governance structure. From Bayer's perspective, this is what innovation in healthcare can look like, where the people most affected by a condition are the ones helping to design the systems around it. That's the kind of innovation that we want to stand behind.
We know from research that when systems are shaped by lived experience, they become more relevant, equitable, and effective, not just for survivors, but for everyone involved in care. People with lived experience bring insights that data alone can capture. What it actually feels like to navigate rehabilitation, rebuild life, and re-enter a world that was not designed for you. Yet across the world, survivor involvement remains inconsistent. It's often limited to consultation, to asking opinions, not sharing decisions. Shine was created to change that. It is about building genuine partnerships where survivor voices help shape the design, delivery, and the direction of post-stroke care and research.
Shine is an innovative initiative. It's built on 3 pillars: survivor-led governance, global inclusivity, and action-oriented advocacy. These foundations make sure that lived experience drives decision, strategy, and action, not just informs them.
In practice, that means connecting survivor advocates across regions from Europe to South America to Australia to share strategies, influence policy, and create frameworks that reflect real lives. We wanted to map out our key stakeholders and engage international organizations to advocate for broader adoption of person-led care frameworks.
Shine's mission so well resonates with Bayer's values around meaningful involvement, values and commitment towards that. For us, this is what leadership in healthcare should look like.
We've now established an international advisory board of globally respected leaders in stroke care and science that spans multiple continents. This includes Bo Norving, Sheila Martins, Urs Fischer, Elsa Stanset, Francesca Pizzella, and Simona Sacco. Shine has developed its survivor-led governance structure, including an advisory feedback stream that allows us to draw on our advisory board's expertise, but keep lived experience guiding our strategic direction.
Our outreach has already begun across multiple regions, including North America, Europe, and Australia. We are connecting stroke survivor advocates who share the same vision, leadership that begins with lived experience. Early engagement shows a strong appetite for this kind of survivor-led cross-collaborations. We are hearing the same message over and over again, and there is real enthusiasm for working across borders, aligning strategies and learning from one another to build more inclusive systems of care. These shared ambitions are already opening doors. Along the way, we have started conversations and collaborations with key organizations such as the Bayer and the European Stroke Organization. These partnerships demonstrate how industry, science, and survivor leadership can work together responsibly and transparently to accelerate change while keeping survivor voices in the lead.
Our collaborations within the area of publications with Stacie, Melinda, and Philips Healthcare is a clear example of that model in action. Together, we've co-authored an abstract that brings survivor voices, scientific evidence, and corporate partnership together responsibly, transparently, and with shared intent. The process showed us just how powerful survivor co-design can be, and how science, lived experience, and industry can work in step to shape meaningful innovation. For us at Bayer, it reinforced what we believe, that responsible innovation begins with the lived experience.
And everything we've done so far, from governance to outreach, this is just the beginning. By connecting stroke survivor advocates across regions, we're building inclusive models that can reshape how stroke and its survivors are seen and supported worldwide. When I had my stroke, I never imagined that I would be sitting here helping to shape global change. This is what survivor leadership means to me. This is proof that transformation is possible.
SHINE is a scalable model for embedding survivor leadership across research, policy, and service design. Together with partners, we are laying the foundations for evidence generation, collaborating on prompts to embed survivor priorities and experiences in how outcomes are measured, and creating the potential to conduct our own survivor-led research in the future. It's proof that lived experience can drive measurable systematic change. For me, this work bridges my scientific and lived experience, two worlds that for far too long has stayed separate.
For us, this is what responsible partnership looks like. Co-designed, scientifically grounded, and genuinely collaborative. It shows how corporate partnerships can evolve to support independence, not compromise it. At Bayer, we see partnerships like SHINE as part of a wider shift, one where survivors and scientists co-design the next generation of solutions together.
And I think this is exactly that. Through SHINE, we're showing how survivor and partner collaboration can make progress more personal and gradually reshape the system.
Our hope is that survivor leadership becomes part of everyday practice, woven into how research is done, how policy is written, and how care is delivered. Because when lived experience informs every level of decision making, it doesn't just change outcomes, it changes understanding.